In this portion of the video, we're going to be showing how to perform a segmental pressure study with PVR waveforms. PVR stands for pulse volume recording. To begin, we're going to press the Studies button on the multi-lab screen, and this will bring up our study menu screen. The screen that you see here in this video is not necessarily the setup that you will have on your multi-lab instrument. Each multi-lab can be configured many hundreds of ways. This is just a configuration that we're using today. We're going to now press number 3, PVRs and pressures for cuff, and at this point we're prompted to enter the patient name. You can use the touchscreen keyboard or you can use your keyboard on the deck of the multi-lab system. Next, you will be prompted to enter the patient ID. This can be a series of numbers or letters. And you can also press the Enter key on your keyboard when you're finished. Next, you'll be prompted to enter the operator name or initials, sex of the patient, and date of birth. As you see on the screen here, we are going to be prompted to do an ankle PVR waveform. We're also going to show how to hook up the hoses to the cuffs. Now it's important to note that when you're attaching the cuff inlet tube to the hose on your multi-lab, you will notice it is a friction fit. These are called lure fittings, and they are a simple press fit. Many people make the mistake of pressing them in too firmly, thinking they might leak. This will make them difficult to remove after your examination. A good rule of thumb is to put the tips into the cuffs gently, and when you remove them after the exam, remove them with just one hand. If you can't remove them with one hand, you've inserted them too tight. We're now going to demonstrate taking PVR waveforms. PVR stands for pulse volume recording, and on your multi-lab instrument, the very top of each study screen will tell you where it would like you to be and what type of action you're going to be taking. Right now it says ankle PVR waveform. The cuffs are in place, the hoses are hooked up. We're simply going to press the inflate button once and let the cuffs inflate to 65 millimeters of mercury pressure. You'll notice that there are green diamonds after the right pressure of 107 and the left pressure of 120. That tells us that our cuffs are equally matched. If one cuff is on too loose, a red diamond will appear. Right now we're going to be looking at the gain, and that we see that the waveforms are exceeding the 30 mark at the top and the 10 mark at the bottom. That tells me that when we go to the calf, we are probably going to be clipping the tops and the bottoms off of the waveforms. So we're going to move the gain down once, and then we're going to let our waveform stabilize, and then we're going to hit the capture button. The goal of taking a good PVR wave tracing is you want to capture about 3 consecutive waveforms of equal size. A lot of patients will present with cardiac issues, and you'll have events like missed beats or double beats, and you do not want to capture those, as those are outliers and not representative of the patient's natural state. So when you see three waveforms in a row that are consistent, you can capture. Now I'm going to describe on this screen how we can manipulate this information. Sometimes a patient will have a tremor in one leg, and the PVR on one side might be artifactually affected and the other one might be fine. So there are scroll buttons at the top of the screen. The double arrow is for fast scroll back and forth, and the single arrow is for slow scrolling back and forth. And I'm going to have her slow scroll both waveforms to the left. Notice how slowly they scroll. Now, using the side button beneath the slow scroll button, we can scroll both at the same time. If we press side once, it'll then go to the right side where we can scroll the right waveform individually, and if we press the side button again, it will now toggle to the left where we can scroll the left waveform independently. Once the waveform looks good, press the next key. We now see the instrument is asking us for a calf PVR waveform. Again, we're going to simply press the inflate button one time, and the pumps will automatically inflate the cuff to 65 millimeters of mercury. If the cuff is above 68 millimeters of mercury, a little OVR signal will appear under the pressure, and if it goes below 62, an UND sign will flash. Anything between 62 and 68 is acceptable. You'll notice now that our calf waveform is completely on the screen. If we had not have moved the gain down from 4 to 3, we would have been clipping off the tops and the bottom. These look wonderful. Both lights are green, so we're going to capture. We're going to scroll the left one back independently. Just one waveform over. Those look fine, so we're going to press next. And now we're going to be doing the above knee PVR waveform. You'll notice the gain stays at 3. Once you set the gain the first time, it will stay at that gain setting for the duration of the exam. So we're going to press the inflate button again. Look for the green diamonds, making sure our cuff inflation pressure is between 62 and 68. Now we're going to look at something a little bit different right now. Besides the pressure and the green diamond indicators, we have two other values. On the right you'll see the number 354. These are how many cc's of air it took to get the cuff to 65 millimeters of mercury. The green diamonds are predicated on the right to left volume. So we have a volume of 313 on the left and a volume of air of 354 on the right. If those two values are within 15%, the indicator lights will both read green. You can also use the baseline down to move the waveforms down without changing the scale. We're going to wait for these to stabilize and press the capture button when we're happy. And we will scroll the left waveform again independently until we have 3 nice consistent waveforms. We're going to press next. The screen is now prompting us to obtain a PVR waveform at the high thigh level. Again, we're going to simply press the inflate button once, and we're going to look at our pressures, our indicator diamond lights, and our volume lights. If all is good, we're going to let 3 consecutive waveforms settle in, and we'll capture those. You'll see the OVR on the left side because the pressure is slightly above 68. If you wait just a moment, that will usually settle in like it did now, and we can capture any time. We're now going to press next, which will take us to a different part of the examination. If you'll notice, at the top of the screen, it's asking us for a right brachial pressure. So at this point, we're going to pick up our Doppler probe, and we're going to apply some gel to the right brachial area. Make sure the patient's hand is flat and facing the ceiling, palm up. We are now going to take our Doppler probe. If you have a patient present that's very heavy set, consider using the 5 megahertz probe, which is also supplied with your multi-lab system. Making sure your probe is at a 45-degree angle to the skin, and then slowly move the probe to the right toward the patient's body. You hear the signal getting louder. Keep moving slowly towards the body until the signal gets quieter, and then move back to the center where the signal is the loudest. This is a very nice signal, so we're going to now press the inflate button one time, and you can see the pressure on the screen going up. Okay, we've now occluded the vessel as evidenced by the pressure of 175 and a flat line, and we're now going to press the deflate button once. You'll see the numbers going down on the screen, and when the pressure in the cuff is lower than the patient's systolic brachial, peak systolic brachial pressure, the sounds from the Doppler will be heard and seen again. I like to wait until I hear 3 or 4 beats before pressing the capture button. Once you press the capture button, you'll bring up the scrolling screen, and what we want to do is we see 1, 2, 3, 4, 5 waveforms on screen. We want to use our slow left scroll button and hold that down until the first waveform, which is the smallest one on the left, bisects the right line on the waveform box. You'll notice the pressure going up, and we'll see that first pulse occurred at 119 millimeters of mercury pressure. We're happy with that, so we're going to press next. The screen is now prompting us to take a pressure at the left brachial site. Pressure is 117. After I take the left brachial pressure, I like to press the back button and compare that pressure to the right brachial. We have 119 at the right brachial, and we're going to press next, and 117 at the left brachial. We're now going to press next. To obtain a dorsalis pedis pressure, first of all, you must locate the dorsalis pedis artery. I like to palpate with my fingers, and if I feel a pulse, I will put some gel right where I feel the pulse. If I do not feel a pulse, I will put some gel on the midfoot and sweep across the top of a foot in a straight line laterally, slowly. The remote control is being used at this point to control the instrument from the patient's feet. The angle of the doppler is again going to be 45 degrees to the vessel. Wait until you obtain the strong, sharp signal, and then press the inflate button on your multi-lab remote. Okay, you can hear that we've got a flat line, and you can see now from the screenshot that we have a flat line. We're going to press the deflate button on the remote control and wait until we hear that first reappearance of a pulse, pressing capture after we hear 3 or 4 beats. There's 4 right there, and we press captured. That brings us to our edit screen here, where we can scroll the waveform back. We hit the capture button right at 109, and then we're going to scroll to press next. We are now being prompted to take a right ankle pressure using the posterior tibial artery. The posterior tibial artery can be found near the medial malleolus if you draw an imaginary line between the ankle bone and the heel, and then put an imaginary quarter up against the ankle bone that bisects that line. That's the region you're going to be finding this vessel. Put a large dollop of ultrasound gel in that area. And this is one area that it can be a little tricky maintaining that 45-degree angle. Most of the places on the body, the vessel is going to be parallel to the skin surface. In the posterior tibial artery, sometimes that artery is going to present itself at 45 degrees when the probe is perpendicular to the skin. So even though it's going to look wrong, it may be correct. Your eyes and your ears will tell you when you have the right value. We're going to add a little bit of volume now to help us find the vessel. We can hear the pulse. Now, once you hear the pulse, don't automatically start inflating. Make small, gentle motions on your Doppler probe, a little up, a little down, a little left, a little right. Looking at the multi-lab screen, we can see the waveforms coming across. We are now going to begin the inflation process by pressing the inflate button on the remote control 1 time. Again, as you see the pressure on the screen go up, you'll hear the sound go away, and the pulse becomes a flat line. Once you see a flat line like this, press the deflate button once, making sure you hold your probe very still, and wait until you hear 3 or 4 pulses before hitting the capture button. Okay, we can capture right there, and we're going to use the slow scroll button to slowly scroll back to that very first pulse. It's not very big, but if you look at the distance, it's the same distance as between the other pulses that were larger. I'm going to go slowly, and we see we now have a pressure at 143 millimeters of mercury pressure. Since this was a higher value than we had obtained on the dorsalis pedis artery, we're going to obtain our calf pressures, our above knee pressures, and our thigh pressures with the probe on the posterior tibial. If the dorsalis pedis ankle pressure was higher than the posterior tib pressure, we would remove the probe, put it back on the dorsalis pedis artery, and obtain the calf, above knee, and high thigh pressures using the probe on the dorsalis pedis artery. Since we are already on the posterior tibial artery, we can still hear a sound and still see a pulse on the screen. So we're simply going to press the inflate button and wait for the waveform to go flatline and the sound to become quiet. You'll want to go 10 to 15 millimeters above the point where the sound and the signal cut out. Once that occurs, press the deflate button, holding the probe still, and wait until you hear 3 pulses. Then press capture. Again, look at the distance between those peaks. If you see one that is not exactly that same distance, it's probably artifact. So scroll back to the first one where the pulses have the same interval between them. We see now we have a pressure of 141, so we're going to press capture or next, and we're going to repeat the process. We're still on the posterior tibial artery, so we're just going to inflate, deflate, and capture. To close to 200 millimeters of mercury. I let my patients know if the pain is excessive, I will simply stop. We're now going to repeat the process at the last site on the right leg, which is the right high thigh. Okay, we've now occluded, so we can press the deflate button. You do not have to wait for the pump to stop before pressing deflate. Especially in patients with disease, the pump may be preset to go to 175, but you may lose the signal at 110. Let the pressure be your guide. 10 millimeters over where the signal flatlines and the sound cuts out, begin your deflation process. We see now that we have the first pulse, and then we have artifact in front of that. If you were to advance the artifact to the right side of the waveform box, that would not be an accurate pressure. By pressing the next or capture button on your remote control, it is now going to prompt us to move to the left ankle and obtain a pressure at the dorsalis pedis artery. Now, one thing you're going to notice when you're going from the right side of the body to the left side of the body is that the veins and the arteries tend to be mirror imaged. So whatever position you found that dorsalis pedis on the right foot, you're going to find it in the opposite position on the left foot. This can save you a lot of time finding those vessels. Now, rather than repeat what we've seen before, I'm going to talk about what you'll encounter in terms of patients that have amputations, patients that have mastectomies, and patients that have arteries that are incompressible. I'm going to take the sound off now and the Doppler probe away, and I'm going to demonstrate to you how you can deal with these situations when they arise. If you have a situation that you're not able to obtain a pressure, simply press the capture button, and this will bring up your edit screen. What you can do here is you can set the output button. The output button allows you to manually enter a value that will be seen by the reading physician. Let's say we have a situation that the pressure and the manometer is 240 millimeters of mercury pressure, yet you can still hear a strong pulse, or a faint one for that matter. There's no need to go higher and risk hurting your patient. So simply hit capture to bring up this screen, and then press the set output button to bring up this screen here. And if you look at the top, it says set output to. You can put, say, N/P for non-pulsatile, so the doctor knows that you are not able to compress that vessel. I'm going to clear this. Some people like to use the greater than sign and greater than 242, which is maybe where they cut off. This will appear on the report as greater than 242. I'll also take this opportunity to demonstrate the view function. At any point in your examination, you can press exit and view, and then you can see what you've done up until this point. You can see if you want to redo something. I usually redo something after I've completed my study. Right now, I'm going to go back to where I was by pressing exit and then back. Okay, what we're going to do now is we're going to change the set output. Let's say the patient has an amputation. I'm going to press set output, and I'm going to clear the contents. and I'm just going to type in AMP. If a patient has a mastectomy, sometimes you're advised not to obtain a pressure at the right or left arm due to lymph involvement. If that's the case, rather than leaving the pressure box empty, simply hit the capture button to bring up this screen and type in MAST, and the doctor will know that you skipped that arm site because of mastectomy. Things happen in the middle of examinations that are unexpected. Let's say someone comes into your exam room and says, "Would you please call your brother?" It's not important. You can call him after the examination, and you find yourself wondering what that could be about. You go back to work, and you find your vessel, and then you inflate. We've occluded, so now we're going to deflate and wait for the return of pulse. There's 4 right there, so we're going to scroll back to that first small blip. Then after we finish lining it up and looking at the pressure of 147, we see, oh, left ankle dorsalis pedis. When you got distracted, you put your probe on the posterior tibial artery. Well, it's a good pressure, it's just at the wrong place. This is where we can use the rename function. If you do have a good pressure, but it's not where the machine thinks you are, simply press the rename button. And then right now, if I advance this, it's saying left ankle dorsalis pedis. I simply move that to posterior tibial and press OK. Now I press the back button, locate my dorsalis pedis, and repeat the process. If any time you think you might have slipped off the vessel, simply hit capture. That will freeze the screen. Press do over, and that will bring up a new fresh screen. Since we're on the topic of unforeseen circumstances, let's say you're in the middle of a patient study and the power suddenly goes out. Your multi-lab instrument is set up from the factory to automatically resume when the power is restored. What will happen when the power comes back on is that your instrument will come up to the multi-lab start screen as shown. If you want to resume your study, simply press the temp file buttons in the lower right-hand corner, and you'll see your patient displayed on the screen here. If you have multiple patients in your temp file, it's going to be the very last one there. Highlight that and press the Edit button. This will now take you to the Edit screen, and in the column here on the left that says Data, you'll see anywhere where there's information means that that step has been performed. So we go all the way down using our down arrow key, and we're going to highlight left calf pressure. That has not been done yet, and we're simply going to press back. We're going to pick up right where we left off. What we're going to do now is we're going to print the exam and send it to PACS. So when you're finished, you can simply press Exit and View. And I like to view my study before I let my patient go to see if there's anything I want to change. So looking at the screen here, my waveforms look good. All very nice left to right, profoundly normal study. My pressures, however, look a little odd. I've got 147 here, 129, and 151. I suspect I might have slipped off the vessel when I was doing the left calf pressure. To go back and perform that step over, simply press Exit, highlight left calf pressure, and press back. Press Do Over, and simply repeat that step. I have retaken the left calf pressure and received a value of 142. I am very happy with this study. It's complete in my eyes. What I like to do first is send my study to PACS and then print it and then archive it. So to get to those steps, simply press Exit, Exit again, and then you can export by pressing this button here. And when you press the export button, you can export that page to PACS, or if you had several studies on that patient, maybe a history page and a post-exercise, export patient will send all 3 studies over at once. Or if you had multiple patients that were not sent to PACS, you can use the export all button. If I want to cancel that, I can also print if I like. The print function is very much the same way. I can print just a single page. If I have a multi-page report, by pressing Print Patient, it will print those multiple pages with one touch. If I want to print in black and white, I can press the Mono button to save on ink. I'm going to cancel, and the same thing with Archive. One thing I need to make you aware of, if you want to send your patient study to your PACS system, it must be done from the temp file. Remember, everything stays in your temp file until you archive it or delete it. So at any time that's in there, I can go back to it, I can export it, I can archive it, I can print it. So I'm going to now archive this study. And when you press archive, again, you can do page, patient, or all. I've just got one page, so I'm going to archive the page. And am I sure? Yes, I am. Now you'll notice the patient is gone from the temporary file, and I can now find that patient using the lookup button. I'll press lookup, type in name, and that's going to be Smith. There's my patient. Now you'll notice I can print it, I can delete it, but I cannot send it to PACS. So that's why you want to send it to PACS first, print it if you want to, and then archive it.